Are you suffering from sacroiliac joint dysfunction? Try these 3 exercises at home to help relieve SI joint pain. Hi, I'm Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. Sacroiliac joint pain is a common condition we treat in our office. The sacroiliac is where the pelvis meets up with your tailbone, and it forms a long joint about 4 inches long, and those are the 2 little bumps you feel in your lower back. It's right kind of at the belt line, and often it can cause pinpoint pain right on the joint and cause lower back pain that spreads out across the belt line, or even just lower back pain that wraps around to the front of your hips. So I'm going to show you 3 exercises you can do to help relieve sacroiliac joint pain at home. So the first corrective exercise we're going to do to stabilize the sacroiliac joint is to do a sit to stand exercise with a mini band. So we're going to take the mini band, we're going to apply it above our knees, we're going to be about shoulder width apart, and then what we're going to do is we're going to just come up to a sit to stand position, but as you're standing up, I want you to drive your knees out against that resistance band, and that's going to utilize your glutes more. So then once you get up to a full standing position, squeeze your glutes together, and that's the exercise. And then we're going to repeat that 10 times. All right, so Renee, I want you to drive your knees out as you come up to a standing position, and then there I want you to squeeze your glutes, and then come back down, and then sit back down, and again, push out, drive out, and then stand up. And what that's doing is it's using the adductors, your quads, and the glute muscles to activate the muscles around the SI joint to help strengthen that area and provide it stability. The second corrective exercise we're going to do for sacroiliac joint pain is we're going to do lateral walks with a mini band. So what we're going to do is we're going to apply the mini band above our knees, and what we want to do is we want to get in an athletic position, and so slight knee bend, slight hip bend, and what we're going to do is we're going to maintain that same distance and take little walks to the right for 10 steps, and then we're going to go little walks to the left for 10 steps. So what it's going to look like, Renee's going to get in that athletic position, slight hip bend there, and she's going to walk to the right, and again, do little steps. And what you're going to do is you're going to feel this in your lateral glute, which is going to, again, help stabilize that SI joint. And she's just going to go back and forth 10 steps in each direction, and she's going to do that twice. And again, if you're doing it correctly, you should feel it in your glutes. That means you're getting a good exercise. The third corrective exercise we're going to do for sacroiliac joint pain is we're going to do a clam shell. So we're going to use the mini band above our knees to start. And what we're going to do is we're going to keep our heels together. We're going to have a slight knee bend. And what we're going to do is we're going to bring this right leg up towards the ceiling. So she wants to open up like a clam. Good, and then back down, and we're going to do that for 10 repetitions. Now the key with this exercise is if your hip is rolling back during the exercise, it's too much of a resistance for you. But you want to maintain just a neutral hip, and then you should be feeling it in that glute area. What it again is going to stabilize that SI joint and help to relieve that SI joint pain. Good, and you can relax. Now, if you find that that is too difficult with the mini band, just do it without it, and just start off with just range of motion and your body weight there. And again, you want to do 2 sets of 10 repetitions on each side there, and that'll help to provide that stability to the SI joint. So if you're suffering from sacroiliac joint pain, give our office a call at 703-912-7822 or schedule online at novacarwellness.com.